random populations. And so they're very common, and it's more common in women than men. And the main reason is because the plumbing of men is much more tortuous, where germs can get into a woman's bladder much easier because of the passageway. But men get bladder infections too. Now, the things that happen with a bladder infection, it can go different routes. So bladder infections can get worse. But for some people, it actually will clear by itself. So not every bladder infection needs to be treated, because the immune system's pretty clever, and just like colds and flus, the body sometimes will just fight it off without antibiotics. So one is that it persists. The second thing is that the body will clear it, just like any infection. The third possibility is that the bladder gets colonized. So the germs are there, but it actually doesn't do any harm. It just kind of just stays there, just like algae on a tree. It's always there, but the tree doesn't get damaged by it. It's just they coexist. So a lot of the elderly patients, they have a lot of germs and things like that, but it's not doing any harm. It's colonized, and so typically we don't treat those. Okay, so if we test for it, then we'll see it and then we'll panic and worry about it. But if we don't test, the patient usually isn't harmed. And then the last thing is that sometimes it can go up into the kidneys and cause a kidney infection or sepsis. So one is that it's a low-grade infection. Second one is that the body clears itself. The third thing is that it gets colonized, and these germs just hang around doing nothing, and people live a long, happy life with this germ that never does anything bad. And then third thing is sometimes it will cause kidney infections or sepsis, infection in the blood. Now, the thing that's different in elderly is that it causes confusion and weakness. And there are times where people have this infection that normally in a young patient is just burning or some kind of problem. But usually in elderly, it can cause almost like they had a stroke. They'll be confused, they'll be weak. I had one person who couldn't stand and move their arms just because they had a bladder infection. As soon as the bladder infection was cleared, it was almost like the stroke disappeared. Okay. So prevention is always a good thing. So if you kind of hold your bladder urine in, the germs have a chance to grow, and so you want to make sure that the person's hydrated well. Problem with nurses is that a lot of times nurses will get frequent bladder infections because we're busy and we don't have time to go to the restroom, so we hold it in, and unfortunately germs start to grow rather than being flushed out. But part of the hydration is to keep flushing out the infection. Now, antibiotics come in two flavors. There are antibiotics that will kill the germ, and there are antibiotics that are called bacteriostatic. It means that it doesn't kill the germ, but it just slows down the growth long enough for the body's immune system to kill the germs itself. So again, a lot of the antibiotics we use kill the bacteria, but some of the antibiotics we use just slows down so that the immune system will kill it. But if the person has a bad immune system, whether they're elderly or they have steroids or they have HIV or chemotherapy or something else, then it's not a good choice to slow it down because the immune system isn't working very well to kill it. So then we would prefer to use something that's bactericidal, something that will kill the germs independent of the immune system. Okay? So the ciprofloxacin, the sulfa drugs, the cephalosporins like cephalexin, even amoxicillin are bactericidal. It will kill. The ones that we use called macrobid or nitrofurantoin are bacterial static. It just slows it down. So we usually have to give it a longer period of time because we have to give the body enough of a head start for it to take over and kill the germs. Okay? Now the ones that are bactericidal, the ones that we use all the time, the sulfa drugs, the cephalosporins, the afloxacins, they kill, but because we've used them so much, they're more likely to not work anymore. The germs have gotten smart enough that they become resistant. And a lot of our patients who are being treated over and over and over again, really, it may not be that the germs are coming back. It may be just the fact that they've gotten so resistant that it's not going to get killed. Okay? Now, the thing about the bacterial static drugs is that because we don't use them as much, the germs haven't gotten smart enough to learn how to resist them. So sometimes, even though all the other powerful ones don't work, sometimes the weaker drugs still have a chance because they haven't been exposed to it enough to learn how to survive these weaker drugs. Okay? But once it becomes resistant to all of them, then no matter what we do, it won't work unless you get something really powerful IV. And for hospice, at least, they're not something that usually we should do. Now, the downside about using antibiotics, whether it kills the infections or not, it kills everything else. So you have more stomach problems because now you have diarrhea. It can affect the kidneys. It could do a lot of other things. So there's harm to antibiotics using it all the time. So it's something that we shouldn't just automatically treat everything, especially if the germ is mild and the immune system clear it, or if it's colonized, because we can do more harm by giving a lot of antibiotics. And so we try not to use it unless they become symptomatic.